the category of problems in long COVID related to vascular damage, right? We know that the spike protein is a toxin. That's very clear in the literature, that its effect on the entire vascular system. And, there's this beautiful little lining of our vascular system, little tiny specific cells that line our vascular system that are similar to mast cells, even though anybody who's a cellular biologist or physician in the audience is going to go, no, that's not a good analogy. But the thing about the lining of the vascular system is that it's very reactive to toxicants. Not only do the cells, are they easily damaged, but they will release a lot of inflammatory cytokines, right? And so with that happens with the spike protein. And so we get a lot of inflammatory. So cytokines are just little cell proteins that are alarm bells that can cause a lot of damage. And so we know that that happens in long COVID. Well, guess what? It also happens when those vascular cells, those endothelial cells, are exposed to certain toxins like lead and like bisphenol A, which is a very common toxin in our plastics that we all have. 93% of adults in the United States, and I think a similar amount of children, have significant levels of BPA in our urine. We test it in the urine. And we never think about this being a problem with either the vascular system or the immune system. But both lead and BPA are toxins for both the vascular system and the immune system. And so this problem with clotting, I know you've seen it in your patients who have long COVID, when for some reason, right, their D dimers go up. And we know that that is reflecting a problem in the blood with microclotting that is not good, because not only does it prevent the blood from oxygenating all the tissues, but it can also lead to clotting problems like strokes, mini strokes, aneurysms, etc.